It's okay?
Yeah.
Okay.
Okay,
So,
so welcome, Dr. Ronit Almog.
thank you. Thank you so much. Tusen tack för invitation till Oslo.
Tusen tack. And thank you so much for coming here and speaking with me. You've traveled all the way from Israel to Norway
Yes, correct.
last night, not only to speak to me, of course, but to do many things here in Norway. And it's so good to have you here and speak. And
Thank
also,
you.
because of everything that's happened in Israel since October 7th. And it's the 8th of March tomorrow, which is the International Women's Day. And you work as a gynecologist. Yeah.
Yes,
Could you
yes.
explain a little bit to people what your field of expertise is and what
Yes,
you
of
work
course.
with?
So, as you mentioned, my name is Ronit Almog. I'm a senior gynecologist in Tel Aviv Soraski Medical Center. I'm a specialist in gynecology, obstetrician, and fertility treatments. But in my other hand, I'm also the head of Ichilov Aid, which is the humanitarian program of Ichilov Hospital that sends medical delegation, humanitarian medical delegation throughout the world, especially to developing countries, in order to assist women, children, and to reduce neonatal and maternal morbidity and mortality around the world.
Wow. Which countries are you working mostly in?
So we've been in many places already. It all started from us wanting to help women, mothers, and children in places where the mortality and morbidity are extremely high. For example, in Myanmar, at least 7 women, die every day due to complications of pregnancy and obstetric complications. There isn't even one family that doesn't know anybody that got involved with such complication. So because Israel is one of the leading countries in that field and the mortality in Israel is among the lowest in the world, we wanted to help women and we started to send those delegations. Quite rapidly, we understood that mothers are coming with their entire families, with children, with husbands, the entire family is arriving. And we expanded our activity to give medical assistance to the entire family. So far we've been in Myanmar, India, Liberia, Brazil, Guatemala. And okay, it's maybe just a drop in the ocean, but it's very meaningful and substantial to those people that we meet throughout the way.
Definitely. You're doing great work. And what does account for that difference between Israel having the lowest rate of these complications and, for example, Myanmar, where 7 women are dying each day, as you say? Why is that? Is it because of technology or knowledge or what
So
is it?
the medicine in Israel is one of the most developed throughout the world. I think this is something a lot of people are familiar with. And we go to places, it's not that the other countries don't have medicine, they do, but we choose the places that need a lot of help. We go to the most remote areas, in unprivileged areas, places in which people have never met a Western doctor or sometimes never met a doctor at all. So they live from agriculture, they don't have electricity or running water, but they're I must say they're very pleased from the load that they have. You learn to appreciate what you have, but still they are living in conditions that don't allow them to get medical assistance. And to those places we come, and what we do, we create improvised health camps. People know ahead the doctors from Israel are arriving. And for example, they take a school. Those days that we arrive, the school is empty. And we create a sort of an improvised health camp. And then we come and we give medical assistance such as gynecological examinations, breast examination, general medicine such as blood pressure and glucose, and also eye examination and prescription glasses. Can you imagine, for example, in Nepal, a woman that is living for her, she lives because she's a sewer and she couldn't thread a needle because she couldn't see well. And suddenly she gets a pair of glasses. For her, this is life-changing.
Yeah.
And also cancer, in places such as India, for example. Women are even afraid to mention the word cancer because they're afraid that maybe they won't be able to work. It will influence their entire life. And in cancer, early detection is extremely important. What happened there is that they don't come to be examined. And when they arrive to be examined, they're already in advanced stages of the disease. And this is why the mortality rates are extremely high. So we come to increase the awareness and to increase the importance of early detection. We always work together with the local medical teams. So this allows cooperation, allows translation, the language we don't speak, and also they guarantee that if we find something, they continue the follow-up and care of those patients also upon our when we leave.
Yeah. Is also, I would imagine that also hygiene is a large part of the difference between developing countries and modern countries to avoid infections and these things.
Of course. This is also, of course, one of the reasons.
Oh.
It's also just not to come and say, I'm the doctor from Israel and to show that how to do operation. The most important thing is to do teaching, to share knowledge, the knowledge that will remain also after we will leave. So we do trainings, hands-on trainings and teaching, and also we bring equipment that in Israel, in our big hospital, which is one of the biggest hospitals in Israel, you don't use it anymore because sometimes it's quite old, but there it can be life-changing. Can you imagine that you bring to a certain village an ultrasound device, and for the first time in their life, people see embryonic heartbeat? This is extremely exciting and also life-saving because, for example, if you have an extrauterine pregnancy, this is a life-threatening situation. It might cause bleeding into the abdomen and it's an emergency. But if you have such an ultrasound, you can detect it ahead and save lives of many women.
Would you say that women's health and these topics that we're talking about now, do they get enough attention worldwide as they should, you think? Are they prioritized highly enough?
I don't think they are prioritized enough. I think for many years, women-related medical issues were neglected, actually. I can give you a few examples of women conditions that are still not being discussed enough. And it's a shame because you can really solve some of them by just increasing the awareness. For example, breast cancer. Breast cancer is one of the leading cancers in women, and more than 2,000 million cases are diagnosed per year. And the talk, maybe there is more talking about it right now, but still in some countries, especially developing countries, women are not aware of it. And it's a shame because early detection can really make the difference in this situation. If you detect it early, you can become a healthy woman. And it's important to talk about it. Also, cervical cancer. Cervical cancer is being caused by HPV, by a virus. If I will ask you how many cancers do you know that you can really prevent? None. But this can be prevented. So if you vaccinate women and men, by the way, at a young age, you can allow them to have protection against the virus before they were exposed to the virus, and you can really prevent cervical cancer, which is a cancer with high mortality rate.
Do we know how much percentage that you can prevent it from the risk?
I can tell you for sure that, first of all, this vaccination is extremely safe. The WHO, the World Health Organization, announced it as as extremely safe vaccination because it doesn't contain the virus. You can't get infected from the vaccination itself. And I can tell you that in countries such as Australia, for example, or England, where there are many years and a high percentage of vaccination rates, they almost completely, they don't have the disease anymore. The rate of they eliminated it almost completely in Australia. So if we will talk about it and people will know that you can prevent it and won't be afraid from the maybe complication of the vaccination that they don't really exist hardly exist because they doesn't contain the virus, you can really save lives. Also, to increase the awareness for doing screening tests, such as pap tests, pap smears. Today, we don't do only pap, we do HPV typing screening test. It's easy to explain because of the COVID, as we did PCR for the COVID virus, we do PCR for the HPV virus. And if you do that, you can detect the virus in early stages and treat it before time develops and it becomes cancerous. So to increase awareness, it's extremely important. And also menopause. A lot of women suffer from symptoms. They don't even aware to the fact that it's a biological process that has a name and you can also treat. Menopause is the period in which the ovaries stop producing the hormones, the feminine hormones such as estrogen, and it has influence on the entire body. Hot flushes is just something that we are familiar with, but it's not only that. It's depression and memory problems, and you can't sleep well. It really infects your entire lives. And not only that, it has influence on the heart. It increases cardiovascular diseases and also the bone density, osteoporosis. And women, they don't speak about it. The
Why
average,
not, do you think?
because maybe embarrassment, or maybe they think that's life and that's what happens, but it's incorrect. And the average is 51, and the life privilege is approximately 84. So that means that women are living more than a third of their life with symptoms. So if we discuss it and know ahead how to treat it, you can improve your life amazingly. So it's important to speak about the fact that you shouldn't be ashamed to mention your symptoms. You should go to your doctors and you shouldn't be silent. Women issues shouldn't be stigmatized because we can really treat them.
Was this like inside of Israel, the culture around this? Is there a lot of openness and awareness of women's issues in Israel?
So I think lately there is a more trend to speak about those things. I can feel it really lately that women are starting to speak more freely and raise up their medical issues. The stigma is becoming less and less common, and I hope still we need to work on that. But I have a feeling that there's an improvement, and as time will continue, and the more that we will speak about it and increase the awareness, it will only do good.
Yeah. Where does it come from, this idea that, or this, what would you say, this dedication that Israel has to the world to go out with doctors such as yourself and to spread knowledge and to help out and to help people with both within medicine and trauma? And I've read a lot about these things, that Israel has lots of programs doing that all around the world, helping out. Where does this come from?
So this is what people don't know. In time of natural disasters such as earthquake, like there was in Turkey, or war, like in Ukraine, Israel is always among the first one to come and assist and offer assistance. But not only that, we really work all the time in doing humanitarian activity. I think this is part of the Jewish religion, to be able to give others. This is something extremely important. This is something that they raise us as small children to be able to give. And I can tell you definitely, as being a doctor who does humanitarian activity, it's not easy. It's not easy to leave your family, to leave the work in the hospital, to leave the work in your clinic, and to go to volunteer in such remote areas. But the doctors who volunteer, they do it of deep desire to help others. And I can tell you for sure that I've learned that the ability to give others is the best present you can give to yourself. Without even speaking the same language, the look on the people's eyes and their gratitude when you help them, this is something that is so heart-fulfilling and so heartwarming that you can't stop doing that. So really the ability to give is the best present that you can give to yourself. And as a doctor who swore the Hippocrates oath, we swore to give medical assistance to human beings, no matter what is their nationality, ethnicity, or race. And it's a big honor to be able to assist people around the world.
It's almost as if it's in the spirit of the land of Israel to go out and help people.
Correct.
Yeah.
It's true. Some people maybe don't understand that, but this is something that is part of us, of the Jewish religion and of the Israeli spirit, to want to be able to give others.
Yeah. But what if you contrast that? What is that like after October 7th? I was speaking with this lady from the Knesset, Shelley Talmeron, who was talking about she sent letters to different women organizations after October 7th and told them about what has happened to women in Israel. And then she asked for a response and what their position was on this. And then she told me she got exactly 0 responses.
Yes, I know. October 7th is, listen, I'm not a politician, I'm just a gynecologist. But I can tell you as an Israeli, as a mother, as a woman, that October 7th was horrible. It's the biggest trauma, and it was a mass murder, the largest ever since the Holocaust. Can you imagine people were sleeping at their houses and suddenly terrorists invaded and took them out of their bed? And I don't want to I mean, again, I'm not a politician, but it was horrible. It's horrible to treat people like this, no matter where you are. And I can tell you as a woman, again, and as a mother, rape should never be used as an act of war, no matter what is your nationality, ethnicity, or race. No woman should ever experience such brutal act of sexual violence. This is unbearable. I always tell people that don't believe it, imagine if it was your own mother, sister, or daughter. The pain would be too much to bear. But what happened to the Israeli people, women, and still going on, because there are some people still, hostage in Gaza. This is something that even to speak about it's so hard that it's a trauma, and we have to stop. This should never happen again, no matter where.
Yeah, I read the report that came out about the sexual violence in October 7th. I also read this book, which is called Testimonies Without Borders.
Mm-hmm.
And a lot of it is just the sexual violence in itself. It's like, I think, first of all, people need to be more aware of that part of it, I think. I think people have forgotten that in the world. Obviously, Israel hasn't forgotten, but I think the Western world, they don't talk about it enough, because it seems like that was a huge part of it, what they did, the terrorists going out. And not only, it didn't suffice with them to just kill people. They had to perform these evil acts as well, just totally unnecessary evil. And it's difficult to comprehend that. Why would you do that? Why wouldn't it be enough for you to just...
This is not excuse of war. No matter, I'm not talking about only Israelis.
Yeah.
I'm talking about people, about human beings, about women throughout the world. Rape and sexual violence should never be used, again, I repeat, as an act of war.
How can we prevent that, you think, in your opinion?
Oh, I wish I knew. I'm not a politician and I can't give solution, unfortunately. I can only give medical assistance. This is what I'm good at. And I'm trying to continue to do good to the world despite of what happened to us. But I hope, I truly hope from the bottom of my heart that people will open their eyes and will understand how traumatized this was.
Yeah, and I can imagine for the hostages also what they went through, and
still are,
right, and also the ones still there, but also the ones who are released, what they are still going through with trauma from those things, right?
Of course, these are civilians. These are not soldiers. These are civilians that were sitting at their home and became victim of a situation that this is unbearable. They didn't choose to become, some of them when they come back, they didn't choose to become heroes, but I truly admire them because they suffered in a way that you can't even imagine. This is unbelievable what people have been through.
How is it possible? Are there many studies on that, women who have been through rape and sexual violence, to be able to come back to normal life and overcome these trauma? I must imagine it'd be very difficult.
This is not my field of expertise, of course, but I can tell you from the Holocaust.
Yeah.
We saw in the Holocaust, women had families and lost their families in the Holocaust and still managed to create new families. And I think Human beings are capable of re-healing, but still, these are things that it's a deep scar that you cannot erase. But I think human nature is stronger than what we can understand and expect, especially after the Holocaust. We can see that people still survived and continue their life, but this should never happen again, anywhere. Not
Have,
only in Israel, not anywhere around the world.
have you also worked on these reports after October
No, I
7th?
didn't.
No.
I know from my colleagues, but I didn't have the opportunity to treat rape victims.
Yeah.
I'm working in Tel Aviv, which is central. But we know from evidence that there were difficult descriptions.
Yeah, and to be able to heal from that too. And also, I think probably for the healthcare workers, it must be a tremendous.
I think all the
thing.
countries is traumatized. People in Israel are sad because this is not something that you can forget and go on. It's a huge trauma.
Why do you think that women are exposed to trauma that way in wars, not only in Israel, but different war zones, that women and girls are exposed to these kinds of sexual violences? Why is that a part of the wars that we see everywhere?
Well, I wish I could tell you that. I wish I could answer. I don't have an explanation why human beings are capable of being so cruel in wars. I don't know what is the explanation for that. I can only tell you, as a mother, as a gynecologist, as a woman, that it's unbearable, and should never happen again. But if I wish I knew how to tell you to be able to avoid that. I wish it will never happen again. We should speak about it. We should increase awareness because, okay, I'm sure wars will still happen, but wars are wars. And sexual violence should never be used as an act of war, no matter what.
Yeah. And as we were speaking about earlier, Israeli hospitals and healthcare workers, you treat everybody regardless of who they are. And
Exactly.
also people from Palestinian areas in
If
Gaza.
you come to hospitals in Israel, you will see people from all over the world, also from Gaza. And I'm not talking just now after the war, but also before the war, because as I told you, doctors are obliged to treat people because of the Hippocratic Oath and because of being a doctor, and that's what we do constantly, all the time. So we have Palestinians and non-Palestinian people in our hospital that are being treated. So you have to treat people because they are human beings, no matter where they come from. Yeah. And this is the leading principle in the medicine in Israel.
Yeah, regardless of the conflict and politics and no matter what, right?
Of course.
Yeah.
You always treat patients, you always treat human because they're human beings. And we do it all the time in Israel.
I wish that the world had seen more of these things that you're speaking about now, because it feels like, at least in Norway, where we're sitting right now, it feels like the media and people here are presenting Israel as some sort of kind of a bloodthirsty country that only wants to kill civilians all the time, that can't stop themselves from bombing civilian areas. They kind of portray that way, in that evil kind of demonic way. How does that feel for you as a healthcare worker, that different kinds of countries portray Israel that way, when you know so well that that's not the truth?
So, of course, it's again, I'm not a politician, and it's difficult for me to speak about politics. But I can tell you that I think there's a lot of misleading from the media, and I don't want to enter this subject because it's not my field of expertise. But I think to kill civilians, this is something that is unbearable, and it doesn't matter where. It's horrible all over the world. I don't want to enter politics, but we all know that terrorists use their civilians as human shields. Yeah. Again, this is not my field. I'm just a doctor. But I think you know what I'm talking about.
Yeah, definitely. Yeah, and also that people can see the evidence of what we're talking about, because one of the terrorists from October 7th was actually treated in Israel at the hospital there. So that brings evidence to what what you're saying, that Israel treats everybody regardless of who they
Of
are,
course.
right? Right.
Of course.
But which countries have you traveled? Also, many places in your profession as a doctor.
Mhm.
Have you traveled? What kind of organizations have you traveled with doing
So
this work?
usually, what we do, we go to destinations where help is required, because help is required all over the world. But in places where they want us to come and
Yeah.
give assistance, it has to be a collaboration. So we worked with in countries where the Israeli embassy has good connections with people who required help or asked for help. For example, India, we have a very good collaboration with India. We did a large health camps for these women that were not weren't aware to the importance of early detection. We worked in a improvised health camp and saw in 1 week more than 1,000 women. It was amazing, and also this created a communication and local and mutual work with the Indian doctors. That will continue further on. We've been in Nepal, in Brazil, in Guatemala. For example, Brazil is a country that you don't have in the middle. You have very high rich population, and the poor population doesn't have access to medical care in the favels and in the remote areas. And after the COVID period, they had a lot of death numbers, and the medicine, the public medicine needed help. So we came there and we worked with them together. Also, Guatemala is very similar, Liberia, many places, and I'm sure we will not stop because it might sound like a drop in the sea, but all these drops, they gather to something meaningful. And I'm sure for those people that we meet in those remote areas, our arrival is substantial and life-changing. It's a big honor to be able to do that, to help others. And this is something, for me, it's a fulfillment of a dream.
Do you sometimes cooperate with different organizations, such as
Yes, local.
Doctors Without Borders and these
Not
things?
specifically this organization, but yes, first of all, you can't do it alone. You always have to work with local organizations, because to come to a country that nobody knows you, it won't do anything. You have to, in each place we were arriving, always depending on the specific location, we work with local medical teams or local NGO organization, depend on the specific location. And this collaboration, this what allows us to be able to do that, because you can't just come and say, hello, I'm the doctor from Israel. You have to be, to arrive to a specific location where people are prepared. They prepare everything ahead and they are looking forward to this assistance. And also we adjust the treatment or the equipment that we bring or the medical sessions according to the specific need of each destination. So depending on the specific country, we work with local organization. For example, in Guatemala, we worked with a specific organization that supports deaf people. Posiegos, that's the name of the organization, and we did collaboration along with them. They prepared all the medical places for us to arrive, and their doctors worked together with our doctors. In India, we worked with an organization called Kushi, which is also an NGO that support the Indian population. So it depends on the specific areas or countries, and the organization are being chosen according to the specific place.
Is it sometimes difficult for you personally as a doctor? Do you sometimes get sad, or is it difficult sometimes, the things that you see and experience?
Two things. First of all, it's very frustrating because you want to do more. You come, it's only a short period. You see a lot of people who need help and you can't help them all. But as I mentioned, although it's just a drop in the sea, it's better than nothing, first of all. And second, it gives you the opportunity to understand how thankful and gratitude we should be for the things that we have. But as a mother, I can tell you that it's sometimes really frustrating and difficult to see children that you want to help them and you can't help everybody.
Yeah.
Sometimes it's not easy.
Is it a challenging field? Do you work with also female circumcision cases where that has happened?
Not yet, although we have plans to do that. For example, in Rwanda,
Yeah.
you know that they had a mass murder there. We are talking about that to do that soon. I hope we will be able to do that. This is our next plan.
Yeah. I just imagine it must be so sad to see
Wow.
these damages done to women and girls.
Unbelievable.
Yeah.
Incomprehensible.
So unnecessary damage too, right?
Of course. And it can be life-threatening, and it has influence on their entire life afterwards. Again, this is things that for us, it's really incomprehensible, but these things happen throughout the world. And we should try to do them as much as we can in order to decrease them and to avoid them.
When women have been damaged through and hurt through sexual violence, does the medical technology and the medicine help you restore? Do they get healthy again in many cases? Are you able to let them have a normal life? And
you can't separate body from soul. Okay, so although in most of the cases, of course there are extreme cases, but in most of the cases after rape, the body continues to function regularly, but the soul is being damaged. And this is scar that you cannot erase. And women that were sexually violated, this affects their life for good. It's, of course, each case specifically, you can't speak in general, but these things are really unforgettable. And it influenced the women for their entire lives afterwards, even though their body continues to function. This is something that they take with them forever. Sexual violence is something that you can't imagine how it scars your soul. It's awful.
in what way do the women mostly say that they have been damaged, with their soul and their mind after a rape? Is there some common theme that goes?
Listen, this is something that you can't put in an algorithm.
No.
I mean, it's different from each person, but even without us discussing it, I think people understand how bad it is.
It's something about the your borders have been violated, right?
Of course.
Somebody has stepped over a line.
You lose your trust in people. It's difficult for you to open to a new relationship. Sometimes difficult to become a mother after being violated. Many implicates.
And as your profession as a gynecologist, how much of your work is the physical, the medical part, and how much of the work is also speaking to women and healing, helping them heal their souls, right?
So my work is, if there were more than 24 hours per day, it would help me. I'm working constantly from morning till night in the clinics, in the hospital. But I also believe from the bottom of my soul in the importance of promoting women health. And, women, they want to know. They don't have enough information. Sometimes they enter the Google and they read, and it makes them even more terrified. So as a gynecologist, I see it as part of my job to explain, to speak about medical illnesses and to increase awareness to feminine medical situations. So I have a column in the newspaper where I write about women's health. I do many lectures about women issues such as menopause, such as urinary incontinence. Out of every 4 women has urinary incontinence, but this is a silent epidemics. Women, they don't speak about it because they think, okay, that's what happens, I have to live with it. No, you can speak about it because there are solutions. Don't be embarrassed. You can speak about it because you have an opportunity to improve your life.
You think there is much shame around this subject?
Yes, I'm sure. So this is why it's important for me to speak about it, so they will know that you shouldn't be ashamed of it. Or also PMS, premenstrual syndrome. Some people think that these women, maybe something is wrong with them. No, this is a physiological explanation. And some women suffer so much that they can't go to work. They can't live their life normally. And there are solutions for this. So you should speak about those things in order to allow women to speak about it and go to get treated.
Where do you think the shame surrounding all these issues come from? Do they think they come from olden times where it was like from 50, 100 years ago, where there was so much shame around this that you weren't just supposed to speak about it, and those kinds of things that are still lingering on?
I think in general, if you will think about it, there are still more men leading than women. There are still more men in the men politician than women. But there are still more male doctors than female doctors. But I'm so happy to say that in the lately there are more and more female doctors. So I think it will take some time, but I think women are now lifting their heads up and becoming more substantial and more powerful. And I think the world will be calmer if there will be more active leading women, actually.
What's that
so.
like where you work, in the organizations where you work as a gynecologist? Are there both many men and women there?
Yes, of course.
Yeah.
I have nice male colleagues that are as sensitive as women. I don't think it's just a matter of how do you say, if you're male or female, of gender. It's about being a person. Like some people are more sensitive and other are less. But still, I think women should get more stage and should be able to speak out and say what's on their mind and on their heart safely.
Yeah. What's it like becoming a gynecologist? Is that a long education? Did you do it in... could you describe how you did it? Was it in Israel, in Tel Aviv?
Yes, I think, yes. And to become a gynecologist, this is something that I always knew that I wanted to do, because this field of interest in medicine is amazing. First of all, it's never stopped causing excitement. To see deliveries, this is the nicest thing you can do. You enter the room with a couple and they live as a family. And it's always exciting no matter how many deliveries you saw before. And also it's challenging because we always treat two patients at the same time and one of them you can't even see. So, and also this field includes everything. I mean, general medicine, endocrinology, surgery. So I love my job. And I think my patient will tell you that they feel it, because if you do something that you really love, you're good in what you're doing. And I really love my job.
So first it's like 5 or 6 years to become a general doctor. 7 years first?
Yes. You study for 7 years and then you do test of general doctor. After you finish this, you have to go to a specialty. And because gynecology is a surgical specialty in Israel, you do a 6-year specialty in the hospital where you learn how to operate and you learn how to be the practical things of a doctor. And then you have 2 tests while those 6 years of residency. And then after you become a specialist doctor, you choose a specific field and you work in this. I do a lot of cesarean sections in the hospital. And I do menopause. And I do general gynecology. But menopause is one of my biggest passion, because so many women suffer from the symptoms and not a lot of doctors are dealing with that. And women feel like they don't have any solution. So I'm proud to deal with this field that is lately really renewing, and a lot of women suddenly feel that they have somebody to speak with. I can feel that lately in the world, menopause subject becomes a hot topic. Yeah.
How were you able to
literally hot? Hot flashes. Yes.
But how were you able to do that? Why is it that it has become a hot topic like that?
Because I think that women, 2 things. First of all, women are starting to speak out and not to be embarrassed or ashamed. And I think also the doctors understood that they have to increase awareness, and they also started talking about it. So the combination of both the doctors waking up and the women waking up, this is what causes the waking up of the subject.
So it's at least 13 years to become a gynecologist, like the first 7 and plus 6 plus.
Plus you have to have children at the same time and work at the hospital, which is really... You do night shifts, you come in the morning and then you remain the entire night, and then afterwards you go home in the next morning, but you still have your own clinic, so you have to go to your clinic.
Yeah.
It's not easy, but you have to love your your job. If you really do it out of passion, true passion,
Yeah.
and you love what you do, nothing can stop you.
And I'm sure the patients see that as well. I think people have that intuition where they just feel that.
The patient and your family, you have to have a
Yeah.
supportive family in order to do that.
Yeah, I can imagine.
Because your children, sometimes they used to call me a mother like that because they were so many days with their grandmothers. So, yeah, it's not easy. But if it's in your soul, if you ask me today if I would be able to do something else, the answer is no.
Yeah.
I would choose the same thing because it's in my soul. I have passion for what I do. I love it.
Yeah.
I wake up every morning with a sensation of happiness in my heart that I'm going to do the thing that I like the most.
I sometimes feel like the female superpower is to be able to create new life. I'm just so fascinated by the fact
Correct.
that it's possible.
The human body is amazing, especially all the pregnancy process. To see a woman and to follow her throughout the pregnancy and to see how the embryo develops and the delivery, I'm telling you honestly, no matter how many deliveries I saw, and believe me, I saw a lot of deliveries, this is exciting. This is a magical moment. The delivery itself and the gathering of a couple to become a family. This is something that you can't. Do you know a woman that doesn't remember her delivery? There's no such thing.
No.
It's one of the most exciting moments in life.
And it's so impressive too, just the fact that the female body is so flexible, also to be able to go from nothing to creating new life, and then going back to what you were from before. How is that possible?
You see, it's possible. Some women, they suffer through the delivery, but they return to deliver again. That means that something happens to us in the brain, and that allows us to continue to give birth. And as a mother, I can tell you that there is nothing stronger than that. Children, you are completely in love with them, and then you forget what happened and you get pregnant again.
Oh, that's so fascinating, because it must be so taxing also for the mother's body to be able to create new life. You need lots of nutrients, you need so many vitamins, you need so much energy to be able to...
That only suggests who is the strong gender in nature.
Definitely.
It's enough to work in the delivery room and to see the woman pushing and delivering, and the husband standing next to her supporting. You understand who is the strongest. And there are more women than men in nature, because the strongest survives. Also, if you go to the preterms, when they deliver, the females have better chance to survive than males. Preterm.
I see. And also, have you ever delivered like twins and triplets, and how many at the same time?
Twins is quite common. Actually, the number are rising because of the fertility treatments, which are very good in Israel. Israel is one of the leading countries in fertility treatments and IVF and fertility preservation. This is something extremely important. I will explain in 1 minute. But triplets we see, but it's not common, because we want to avoid it. It's something that can be dangerous, especially because of the risk of preterm delivery, which has influenced for the immaturity complications.
Mm-hmm.
But fertility treatments in Israel are very strong, and if there is a take-home message that I can send to women around the world, is the importance of fertility preservation, because that unlike men that are providing and all the time they can have sperm. Women are born with a fixed amount of oocytes that only lowers as we become older. And we know that after the age of 35, there is a decline in the quantity and quality of oocytes. So, and today women, because of the social clock and, the studyings and the jobs, they start their family plan at the older age. But the oocytes are not programmed to the new social clock. So if you want to be able to make sure that although you're very busy with your career and you want to make sure that you can preserve your fertility, we can do oocyte freezing these days, which is amazing. So if you do it, you should do it before you're 35 because afterwards the quality and quantity declines. The lower you will do it, it's better. And we really discuss, it's not, it doesn't have enough stage yet, but it becomes more and more common to do that. And if before we did it only for women that had cancer and got chemotherapy, for example, today we can do it also for women that just want to have the ability to preserve their fertility. So this is also something that becomes stronger and stronger in Israel.
Do women in Israel typically have children at a young age when they're young, or do they wait typically, or do they have any
Depends, but I can tell you that because of the way the modern world is living with the new job, with the jobs and the studyings, also in Israel, the family planning it becomes later these days. And this is why it's important to talk about it and to be able to think about it ahead before you miss the train.
Yeah, because I heard that Israel has one of the highest birth rates in the whole of Europe, and including Israel. Why is that, you think?
I don't know. I think the average number of children, at least, I don't know if it's accurate statistically, but I can tell you from my surroundings, is around 3 children per family. Although in religious families, the numbers are much higher than that. And the large number, I think, is because of the religious families, because it's a kind of a mitzvah. You know what is it?
Yeah.
It's a good will to do according to the Judaism. So the religious people, they have many children, but in the average is, I think, 3 children in most of the families.
Is it also something about the culture in Israel sanctifying life, where life is so important?
This is why in the religious people there is a large number of children, but most of our surroundings are people not extreme religion, and the number, I think, the average is 3, sometimes. Let's say between 2 to 4 children per family.
Do you think we will see like a baby boom as you had after the Second World War?
We see already.
You see
great.
already?
Wow, amazing. The delivery room is constantly busy. There's a traumatic, extreme baby boom now. A lot of deliveries, a lot. We can really feel that. We are busy all the time.
What do you think? Why do you think that happens?
I don't know what is the correct explanation, but I think during a time of war, people find comfort with each other. Also, it gives you a shock what happens to your nation, to your people. So you want to show that life continues. I guess there are many causes for that, but I can tell you definitely that we have baby boom now. So many deliveries. This is unbelievable.
It must be a great place to work.
Yeah, optimistic.
Yeah. But do you think that, what's the society like just for you personally in Israel now? Do most people, is it back to life as normal, or is it still like a difficult period of time to live in Israel after October 7th, with everything with the hostages being there still? What's it like, the feeling, the mood of the country?
Israel is home. And at my home, Israel, I think people are, okay, sometimes we fight, sometimes we have different opinions, but the Israeli people are united. It's correct. And especially at those days. And I think we are walking in Israel in sensation of sadness. Really sadness, because our home was invaded. Our people were slaughtered, massacred. This is something that you cannot erase. And people are supporting each other, but I can really tell you that there is a sensation of sadness in the air. People are not the same as they used to be. It catches you all the time because people are still in Gaza. So no matter where you go, the sadness is surrounding you. I think till the last person will arrive back home, Israeli people will not be happy. You can't be completely happy when you know that there are families that their loved ones are still in Gaza, and we know how big their suffering is. So for us, Israeli people, the sadness is surrounding us all the time. And I think we won't be able to be completely, okay, life is continuing, but we won't be able to be truly happy till the last one of our hostages will come back home.
Is it like an open wound?
Of course. Of course. Listen, there are some people who are still in nightmare there, and we see their families all the time. They don't. They are talking all the time. They are trying to do the best they can in order to bring their loved ones home, and it's really, really sad. Honestly, our country is traumatized. It's nothing is the same. People are sad. People are sad because what happened is something that you cannot ignore it. It catches you whenever you go. It's stronger than us.
Do you think it felt different now with October 7th than just for you personally? Then as you know, everybody knows that Israel has had lots of terror attacks with the intifadas and everything, like lots of terrible situations and terrible kills and deaths and everything. But there's something totally different with October 7th, the feeling between people.
The feeling is that somebody touched the deepest parts of your heart. Honestly, we cannot ignore that. We have to continue, the Israeli spirit should continue. We should continue to give others around the world because this is us. But we cannot forget what happened. And till the last one of our hostages will come back home, we cannot be completely ourselves again.
Yeah, I understand that. I spoke to an Israeli here in Norway, and I was like just having a conversation, and I'm asking like, yeah, Purim is coming up. Are you going to celebrate and everything? And they said, no, I can't. It's impossible for me to celebrate now.
I mean, people are going to restaurants still. People are living, but I don't think there will be even one Israeli that you will speak with that he will tell you that is the same as before.
Yeah. In what sense do you think that you've changed?
Listen, it's a trauma. It's a trauma. Imagine you, if it would happen to your home, how would you feel?
Yeah.
The pain is too much to bear. This is not something that you can erase. I just hope from the bottom of my heart that those that are there still suffering will come back home. Really, this is the most important thing for us right now.
But how are people able to function in their lives, in their jobs, with this hanging over you, with this?
I think
sadness?
life is stronger than us. For example, you can ask me how people survive the Holocaust and still live and have families. This is the human nature. Life is stronger than everything. But still, these are things that you cannot erase.
You think Israel will never be the same when all of this is done?
I don't think. I'm sure.
You're sure?
Yeah.
In what sense do you think?
This scar, as I told you, this is not something that you can forget. I mean, this is something, the fear will be always there, the mistrust, the fear that this will happen again. It's rough.
Are you afraid personally also that it will happen again?
I don't think there is a Jewish person who is not afraid.
Yeah.
You can feel hatred. And this is a shame because I know that despite of the way people think about us, the Israeli spirit is good. Sad to talk about it.
Yeah, it is.
Mm-hmm.
But I think also important to acknowledge it, because if we try to pretend that it isn't there, then there will be no growth either, I think. It's
to tell you that it's not frightening. Of course it is.
Yeah. How do you balance that?
But hate is something bad.
Yes.
Hate is bad. Terrorism is bad.
Yes.
I mean, the human nature should be good to each other all over the world, but this is not something that we can always control, and that's the problem.
Yeah. One can wish that it's like that, but sometimes it's just not like that in reality.
I'm not a politician, and I'm trying to answer those questions, and I'm not sure that Just being a doctor, being a human being, I think I can tell you about myself, not about others.
No.
That I will continue no matter what to do good to the world. I will continue to do humanitarian activity. I will continue to take care of women, regardless of their nationality, regardless of their race. Doesn't matter. Human beings are human beings, and we should treat all human beings with respect and kindness. And this is at least the leading thing for me, and that's what I'm trying to teach my children.
That's a very good attitude to have. I think that's what makes us overcome these kinds of evil. When you see that, like, overcome it with more love, more light, and just remember who you are, and not to cave into that kind of, get dragged down into that darkness, right?
To this hatred.
Yes. So always try to rise above it.
Yes.
But it's...
I always believe, I'm telling my children that if you do good, others will do good as well. So I choose to do that.
Yeah. And I feel like also there's a tremendous strength in the Israeli and Jewish people to be able to, that resilience, to be able to overcome enormous amounts of tragedy and trauma.
This is part of the Judaism, I think, to be able to be strong, to survive, to give others, to see the light in the darkness. But first of all, we have to first protect ourselves, and then, in order to be able to do so. But really, the Israeli spirit is good. I can't talk about others. I can talk about myself. I know that I will always. This will be the leading way for me to as a doctor, as a mother, as a human being, to do good to others. Yeah. That's honestly what I believe in.
Yeah. I think that's important for many people too, because I feel that too. It's so easy to get dragged down into that negativity or hate or that binary kind of tribalism, right? Which is, I think tribalism is so much of the cause of so much tragedy and war and in different places of the world, where it's my tribe against your tribe and let's kill each other until there's no one left, right?
Yeah.
So it's so important not to get dragged down into that and try to stay above it all the time.
Yeah.
But Dr. Ronit, thank you so much for speaking with me today.
Tusen takk. It was, for me, it was great honor to be invited to come here. And I hope people around the world will be able to just a little bit understand and see and know. If all of us will want to be together and to do good, hopefully the world will be better.
Let's try to live in that spirit. And thank you so much for your work. And I wish you the best for your work going forward.
Thank you so much.
And Am Yisrael Chai.
Am Yisrael Chai.